I think one of the burdens of the elderly people is the cost of providing healthcare. Gaps are important, and almost every patient that I see is concerned about the gap required to pay to have surgery done. This program of no gap surgery alleviates some of those concerns and allows the patients to focus on their recovery rather than on their monetary concerns. Once I've determined that the only option for a patient is either a hip or a knee replacement, they can rest assured that throughout their treatment they will not incur any expenses. There will be no surgical expenses, whether from the operating surgeon or the assistant. There'll be no gaps charged by the anesthetist, and there'll be no out-of-pocket expenses if they have blood tests or imaging tests done within the hospital. Also, their post-operative care, such as rehabilitation and post-operative follow-ups, will be covered within the same program. Once I've established that a patient will benefit from either a hip or a knee replacement, they will have their medical condition assessed to ensure that they are fit to undergo surgery. They will have routine blood tests to check for any potential comorbidities that may delay or prevent their surgery, and then these patients will be referred to the joint school. It is an important part of the program, and at the joint school they'll be assessed by a physician, by a physiotherapist. They will be explained in further detail what their trip through the hospital involves and what their post-operative recovery will be. The best thing about this process is that the patients receive world-class surgical treatment combined with excellent rehabilitation at no cost, and there's no concerns to them. They are able to focus exclusively on their health and recovery. Any patient considering the no gap surgery program would first need to see their GP and have their condition diagnosed, assess whether they do have hip or knee arthritis that may or may not require joint replacement surgery. Once that condition is diagnosed, then they need to see a specialist, and a discussion is to be made whether the patient would benefit from a hip or a knee replacement. Once that's been established, then the patients can make a decision whether the no gap program is suitable to them. Patients can rest assured that if there are any complications, they will be looked after immediately at no cost to them.